And I'm glad you mentioned what we're observing in terms of younger people being diagnosed with colorectal cancer more often than we saw in previous generations. And I did want to point out that, that's not strictly hereditary or genetic, at least as far as we understand right now. I think there's many groups that are trying to figure out the why of that observation. But it's one of the reasons that now the recommendation is for everyone in the general population. So we're not talking about people with genetic risk or hereditary risk, or even those with family history of colorectal cancer. They would have slightly different recommendations. But those who are at general population risk for colorectal cancer, that they are recommended to start some type of colorectal surveillance starting at age 45. So Dan always tells his story, which makes perfect sense that he got his first colonoscopy at age 50 because that was the recommendation at the time. And with this observation of younger people getting colorectal cancer, the recommendation is now 45 in the US. And that could certainly include a colonoscopy as one option. There's also stool based testing. People have heard about Cologuard or other FIT based tests. There's also some blood based testing that has some really exciting data and I think will be more widely adopted as well. So, what the gastroenterologist I work with, and I think a lot of people in this field will say, like, the best screen is the one that gets done. So,
Sure.
if you're not somebody who wants
Yeah.
to do a colonoscopy and you have average risk, there are definitely other options for you.